next speaker for today is a professional who practices medicine, which is concerned with promoting, maintaining, or restoring health through the study, diagnosis, prognosis, and treatment of disease injury and other physical and mental impairments. He is a graduate of Ateneo de Zamboanga University, nursing in 2009, and Doctor of Medicine in 2013. He wrote a research and thesis on factors for family planning on non-acceptance among reproductive age women in Barangay San Miguel, Barangay Tinglan, Mutya, Zamboanga del Norte, and other about prevalence of depression and types of stressors and coping skills of private first-class soldiers deployed in Zamboanga City. He was an emergency room physician in Zamboanga Doctors Hospital, Brent Hospital and Colleges Incorporated, Universidad de Zamboanga Community, Hospital, Zamboanga Peninsula Medical Center and West Metro Medical Center, and he was also a medical officer in Adela Serra Memorial Medical Center, Surigao del Sur from 2017 and 2018, and currently a medical officer in Zamboanga City Medical Center since 2007. So again, everyone, let's all welcome virtually Dr. Zanjani Pawaki. Hi, sir. Good afternoon.
Afternoon. Okay. So good afternoon, nurses. Thank you for that introduction. I would like to introduce myself again. I'm Dr. Zanjani A. Pawaki, Senior Resident Doctor of the Department of Family and Community Medicine of Zamboanga City Medical Center. And as an alumnus of ADSU College of Nursing, Batch 2009, it is my honor and my pleasure to be invited as a research speaker of your webinar this afternoon. So earlier, Dr. Sala basically discussed everything about COVID-19, yung clinical aspect. Now, for my presentation, let me be allowed to share the screen, my presentation to you.
Ay, nakuha ko, sorry.
Yeah. So, my presentation is entitled Gabay sa Pamilyang Pilipino sa Panahon ng COVID-19. Will include discussion on family-focused and community-oriented interventions lifted from the consensus statements of the Philippine Academy of Family Physicians. I also included mythbusters on common misconceptions about COVID-19 in line with our theme, Combating Disinfodemic, Deciphering COVID-19 Disinformation. And to start my presentation, I would like to present to you the outline. Part 1, I will be discussing on the family-focused home care plan during COVID-19 pandemic. And part 2 would be discussion on the community-oriented interventions during COVID-19 pandemic. So, the Philippine Academy of Family Physicians, a specialty medical organization, has come up with a consensus statement on family-focused home care plan for the Filipino families during this time of pandemic. It aims to guide not only doctors but also other allied professionals like nurses in providing interventions geared towards addressing health issues surrounding a family during the COVID-19 health crisis. So let us start by presenting a case.
Outlet na
So,
parang ito yung nangyayari siguro sa...
Okay. This is a case of ANENO family. The ANENO family came in for family consult at the local health center with concerns about COVID-19. They were anxious about the news that a person from their neighborhood has symptoms of COVID-19. So now, as the community health nurse, what family interventions will you do to address ANENO family's concerns? This particular case asks for the role of community health nurse in addressing issues and concerns of a family surrounding COVID-19. The community health nurse needs to be equipped with knowledge and skills to provide quality care for the family. So the first thing to do for the community health nurse is to develop a family-focused care plan. To address the safety issues and health concerns of ANENO family. The first thing to do, so a family-focused health plan will include discussion of the plan, treatment goals, and preferences, and may consist of single or several family meeting sessions. It can be done by a doctor or a trained allied health worker like a nurse over the internet or any forms of digital communication. The community health nurse should also identify family members who are at risk. So this was mentioned earlier by Dr. Sala. No? As mentioned, there are specific population at risk for developing severe COVID-19 illness, to include the elderly, yung people with underlying conditions, and also children with underlying conditions, specifically those children who have neurologic, genetic, metabolic, and congenital heart diseases. Also, high risk are those pregnant women with high risk pregnancy. These individuals should be educated to take extra effort to reduce the risk of getting the disease. This intervention then will correct the myth on COVID-19 that it affects a specific population group. So again, people of all ages can be affected by the COVID-19 virus. However, specific populations, as mentioned earlier, may develop severe infection. This table shows the list of diseases that are at high risk of developing severe COVID-19 illness. We have a range of kidney diseases like chronic kidney diseases, pulmonary diseases like COPD and asthma, immunocompromised state, obesity, serious heart conditions, blood dyscrasias like sickle cell disease and thalassemia, and endocrinopathies like type 2 diabetes and diabetes type 1. The community health nurse should also identify a caregiver who can be any member of the family. The family caregiver plays a vital role in direct and supportive care to patients in the family, and they encourage family members to cooperate to sustain their adherence to the family plan. However, in some instances, yung family caregivers can develop stress and anxiety during the course of giving. So yung role natin bilang community health nurse, we have to encourage them to engage in self-care activities and leisure time, of course, with observance of strict COVID-19 precautions. Another family intervention na pwedeng gawin ng community health nurse should advise and educate the family to practice personal hygiene. So ito na yung sinasabi kanina ni Dr. Sala, yung minimum health standards, including appropriate hand washing, daily bath, cough and sneezing etiquette, minimal hand contact with eyes, nose, and mouth, and strict personal use of eating utensils and bath towels. For hand washing, it is recommended to wash the hands with soap and water for 20 seconds or more. It does not matter whether the soap or detergent has antibacterial property or not. The community health nurse need to stress the importance of these measures, itong mga minimum health standards natin, in preventing COVID-19 infection or any infections at that. There are also families who believe that rinsing the nose with saline can prevent COVID-19. So similar siya sa myth na yung nagpapausok sila, yung steam inhalation, no? So again, yung community health nurse should educate the family about this. There is no evidence that regularly rinsing the nose with saline has protected the people from infection with new coronavirus. Although yung nasal saline, yung saline solution kasi are sometimes used to relieve common colds. However, yung regular rinsing of the nose with saline solution, hindi naman siya nakaka-prevent ng respiratory infection. So we have to inform the family about these things. The community health nurse also should advise the family not to spray or introduce bleach or any disinfectants into their bodies. So earlier sa later part ng discussion ni Dr. Sala, na-mention niya rin to, no? Because we all know that these substances can be poisonous if ingested and can cause irritation and damage to the skin and the eyes. So bleach and disinfectant, we have also to tell the family na itong mga bleach and disinfectant should be used carefully to disinfect surfaces and has to be kept out of reach of children. Next is to inform the family that drinking methanol, ethanol, or bleach does not prevent or cure COVID-19 and can be extremely dangerous. So may mga family kasi na may paniniwala sila na pag uminom ka ng methanol or ethanol or alcohol or Zonrox, it can cure COVID. So you have to really debunk this myth, no? So the family should be informed that these are poisons and drinking them can lead to disability and death. So methanol, ethanol, and bleach are sometimes used in cleaning products to kill the virus on surface. However, they should never be ingested. The family should be educated that they will not kill the virus in the body and will only harm the internal organs. So it can cause burns, diba, sa internal organs. Next intervention would be daily cleaning of frequently touched surfaces should also be advised by the community health nurse. These include doorknobs, light and appliance control switches, gadgets, armchairs, and tabletops. As mentioned nga kanina by Dr. Sala, no, yung SARS-CoV virus can stay on plastic, stainless, and other surfaces. And they can stay there for a number of hours. So kailangan i-emphasize natin itong intervention nito. Ordinary detergents and water or 70% alcohol can be used as cleaning agents. These common household cleaning products, however, like mentioned earlier, kailangan sila nakastore doon na hindi maabot ng children. This has to be emphasized by the community health nurse when educating the family to avoid poisoning and contamination. So etong next myth, no, sinasabi ng ibang family na yung shoes daw can cause transmission of COVID-19. So we have to debunk this myth by saying that this family should be advised that the likelihood of COVID-19 being spread on shoes and infecting individuals is very low. Pero we have to advise them that as precautionary measure, particularly doon sa mga bahay na may babies or small children na nagko-crawl or naglalaro sa floor, family members should consider leaving their shoes at the entrance of their home. This will help prevent contact with dirt or any waste that could be carried on the soles of the shoes. So very low yung likelihood of shoes spreading the COVID. However, kailangan pa rin natin silang i-educate na iwasan yung pagdadala ng shoes inside the home. The use of UV radiation for disinfection has also been rampant nowadays, no? However, we need to warn the families na yung UV radiation, you should not use it with sa skin and sa eyes because it can cause irritation and damage sa mata. And cleaning the hands with alcohol-based hand rub or washing the hands with soap and water are already enough and effective ways to remove the virus. Next intervention is identifying an isolation room. So we need to emphasize as community health nurses yung environmental and infection control at home, no? An isolation room, kailangan ma-identify ng family together with the community health nurse. And this isolation room will be used in case a family member is exposed to a possible or COVID-confirmed case. An ideal isolation room should be one with negative pressure. So yung isolation room, ideally, it has to have a negative pressure. And a negative pressure room at home is simply a room with an exhaust fan installed either in the windows or in the ceiling. This is a common appliance for bathroom and toilets. I'm sure you're all familiar with it, no? And it should also be included in the health teachings that the room should have its own bathroom and toilet. So kailangan it has to meet a certain criteria para ma-qualify siya para pwede siyang maging isolation room. Lastly, it is important for the community health nurse to educate the patient on what to do when a family member is exposed. The community health nurse should educate the family of the signs and symptoms of COVID-19, and the family should be advised to watch out and monitor for these symptoms and to report to health authorities once a member is exposed. So earlier, na-mention din sa atin ni Dr. Sela ng infectious disease specialist natin, yung mga common signs and symptoms no, ng COVID-19 which are fever, cough that is usually dry, fatigue, and other uncommon symptoms. We should also advise the family to adhere to community quarantine measures by staying at home, isolating family members exhibiting symptoms, wearing of facial mask, and physical distancing at least 2 meters. Previously, yung ginagawa namin, for patients with mild symptoms, we usually manage them at home and advise to continue home quarantine. We usually advise them to take over-the-counter medications for symptoms like fever, and to increase water intake, ensure adequate nutrition, sleep, and rest. Pero with the current trend that we have right now, no, dumadami yung cases natin, it is recommended to refer these exposed individuals or these individuals with symptoms to a health facility for evaluation and management with possible COVID-19 testing. In addition to that, no, we have to be aware that this pandemic has resulted to a wide variety of psychological problems such as panic, anxiety, and depression. Thus, as community health nurses, we need to provide psychological and social support to the household members who are exposed or isolated. The community health nurses should also stress ito in relation to our topic, no, the importance of access to credible and truthful information by providing the family a list of resources. So like what Doc Sala kanina mentioned, sa internationally, World Health Organization or the Center for Diseases and Control, or locally we have the DOH because they have a portal for yung COVID-19 information. Another myth na kailangan i-address natin is the belief that the prolonged use of medical masks when worn can cause carbon dioxide intoxication and oxygen deficiency. So we need to tell the family na yung wearing of medical mask or any mask, no, can be very uncomfortable, pero it does not lead to carbon dioxide intoxication and oxygen deficiency. Also advise that pag nag-wear sila ng mask, family members should make sure it fits properly and that it is tight enough to allow them to breathe normally. Lastly, advise not to use a disposable mask and always change it as soon as possible. Another fact that we need to tell the families is that people should not wear masks when exercising, as masks may reduce their ability to breathe comfortably. Sweat can also make the mask become wet more quickly, which makes it more difficult to breathe, and it can also be a medium for growth of microorganisms. So we need to tell the family that the important preventive measure during exercise is to maintain physical distance of more than 2 meters. So pag nag-exercise, okay lang walang mask for as long as we maintain physical distancing. For some families, no, may mga families tayo na makukulit, they try to convince you to prescribe them antibiotics. However, we need to emphasize that antibiotics cannot prevent or treat COVID-19. Basically because no, the general idea na antibiotics do not work against viruses, only bacteria. However, for those people who are infected with COVID-19, when they are admitted, pwede silang magkaroon ng bacterial co-infection. So that's the time they can be given antibiotics. Pero for patients who are exhibiting mild symptoms, pag humihingi sila ng antibiotics, we need to tell them that it is not the right medication for them. And lastly, we need to inform the families that at the moment, there is no specific medicine recommended to prevent or treat the new coronavirus. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to accelerate research and development efforts to come up with a drug and a vaccine. So everything, yung drug and the vaccine, all under investigation pa. Nasa phase 3 pa lang yung vaccine ng clinical trials. So we need to wait a little bit more. So, yan. The ANENO family have been oriented to the family focus plan developed by the community health nurse, and now they are educated with measures in preventing and preparing for an impending COVID-19 outbreak. At the end of the consult, ANENO family feels safe and was relieved from anxiety. It is also important for community health nurses to note that yung family-focused health plan natin is carried out over a period of time. Meaning, hindi lang siya one time, no? We need to monitor yung mga interventions na ginagawa natin, or we have to reinforce them in terms of educating them, ganun. And it can be revised based on the present needs of the family. So we need to anticipate na paiba-iba yung needs ng family based sa current situation. So we need to be able to adapt to that changes. Now, moving on for the community-oriented healthcare during COVID-19, the PAFP again, yung Philippine Academy of Family Physicians, also developed consensus statements on community-oriented healthcare during the COVID-19 pandemic with the same aim of guiding community health workers in addressing issues and concerns surrounding COVID-19 in the community. Yung community health nurse being part of the community health team can take or may take the lead of addressing them. So, we need for the next slide, it's another case, no, for the community-oriented healthcare plan. So, kunwari, the local health board of Barangay ANENO declared a community lockdown to prevent an impending COVID-19 outbreak. So, being the community health nurse, ikaw yung part ka ng community health team, probably the one who leads the team, you are tasked to develop a community-oriented healthcare plan. So, ano yung gagawin mo? Ito. So, first, the first intervention is, of course, you need to develop the community-oriented healthcare plan. No? This is a very challenging task for the community health nurse because it involves tasks and activities related to community organization, yung environment, healthcare, and social processes. And coordination with the community health team, community stakeholders, and the community people is an important factor in the success of developing and implementing such plan. In conjunction to that intervention, the community health nurse should develop or organize a local health task force. In our current health system, for example, yung mga LGU natin, we have our own local health board sa province, sa city and municipal, and even sa barangay health level. And they have varying levels of function and activity. Under ordinary conditions, itong health board na-organize siya. But in terms of pandemic, in terms of disasters or pandemic like COVID-19, yung Barangay Health Emergency Response Team natin or yung BERTS is activated. So recently, yung DILG and the LGUs, yung DILG particularly, advised yung mga LGUs natin to form our own COVID task force, like similar to the one we have here in our locality. Yun. So the next intervention is to identify a barangay health facility that can be used for isolation in case a member is diagnosed to have mild COVID-19. A hospital referral facility should also be identified for patients with moderate to severe cases, as well as establishing a referral and transport system. This community facility will be very helpful for households with inadequate space or room for the isolation of a family member. So kanina nga, we mentioned sa family healthcare plan natin that we can identify, that the community health nurse pwede siyang mag-identify with the family ng isolation room. However, considering yung conditions ng ibang families, no, the barangay can put up its own barangay health facility. Or in the case dito sa city natin, hindi siya barangay, hindi siya per barangay. Parang for the entire city siya. We have the Adsulantaka campus, yung Ecozone, Kabatangan, as provided by the City Health Office, housing patients with mild symptoms not needing hospital admissions. The CCMC, yung Zamboanga City Medical Center, is our COVID referral facility, and each has its own referral and transport system. So nagko-coordinate lang sila. For mild cases, or even the asymptomatics na nagpo-positive, they can be housed doon sa mga community health facilities or barangay health facilities. However, for those patients with moderate to severe symptoms o yung may mga comorbidities, yung mga high risk na kailangan i-admit, they are referred to a hospital. Like in our case, we have the Zamboanga City Medical Center. So may emergency referral yan and transport plan, no? Yung sa pag-transport ng patient, pati na rin yung pag example nag-expire yung patient. So may process na yan lahat. During the quarantine period declared by the community or higher level authority, the community health nurse should include in the plan to inform all household members to stay at home, limit celebrations, community gatherings, and cancel travel plans. In the Philippines, we have the several community quarantine measures ranging from, we already experienced yung ECQ, GCQ, and MGCQ, which were implemented sa lahat ng provinces with specific guidelines made into a law. The differences in these quarantine measures should be disseminated to all households in the community. So task din natin yun. For example, where the head of the community health team kailangan ma-disseminate to each household yung mga guidelines. Although we already have din yung sa social media na nababasa na rin ng iba, but for those households na walang social media, they don't have access to social media, to any forms of digital platform. So kailangan ma-disseminate yung mga guidelines para clear to the families kung ano yung mga gagawin nila, kung ano yung pwede at hindi pwede. It is also important for the community health nurse to advise the community health team, especially those who have contact with possible and or confirmed COVID-19 infection, to wear appropriate PPEs, which include face masks, goggles, gloves, and PPE suits. But the community health nurse bilang head of the team should make sure na yung mga health workers na hindi naman kailangan ng complete PPEs, like yung more on documentation lang yung ginagawa, they can wear yung mga they can wear masks, face masks, ganun. Pero for those with contact talaga to mga patients na may exposure or confirmed cases, they have to wear complete PPEs. No, yung kasama na doon yung mask, gown, and eye protection, because the use of such equipment protects both the health worker as well as the community against the spread of the infection. Next, intervention. No? So as community health nurses, we all know that health education is an important tool to prevent transmission of infectious diseases like COVID-19. So another intervention that can be done is developing a community-directed information, education, communication plan that targets all households in the community. So the community-oriented IEC should include the following. Kailangan ma-inform yung every household in the community about COVID-19, no? Like everything about COVID-19, from signs of symptoms, ano yung gagawin, like yung mga community, also yung about community quarantine measures, and the community plan itself. So if you made a community-oriented healthcare plan, kailangan alam yun ng community people. Next is, dapat kasali doon sa IEC plan natin yung yung emphasis on the personal hygiene, yung environmental sanitation, like specifically cleaning frequently touched surfaces. And also, we need to encourage the community people not to report and seek help from a community health worker if a household member is exposed and has developed mild symptoms of COVID-19. Okay. So lastly, the community health nurse should provide proper reporting and documentation of the community-oriented healthcare plan. The municipal or city health office should be provided with a daily situation report to include yung numbers of members of the community na na-expose, yung mga diagnosed cases natin, mild cases, cases na na-refer to hospital, and yung cases na nag-recover and namatay. Yan. So, what happened na ngayon as a community health nurse na naka-develop ka na ng community healthcare plan mo? So, eto. The community health nurse together with the community health team has developed a comprehensive community-oriented healthcare plan for Barangay ANENO. Barangay ANENO is now prepared for their battle against COVID-19 pandemic. To add, with this plan in place, the community health team should include adjustments needed to continue the delivery of other health services. So, despite having this comprehensive community healthcare plan, kailangan we should not take for granted yung other health services that are already existing, especially yung maternal and child health, yung immunization and treatment of communicable and non-communicable diseases. So it does not mean na nag-focus tayo sa COVID-19 kasi ito yung uso ngayon or ito yung nangyayari ngayon, that we take for granted other programs. It still have to be delivered sa mga community people. Of course, with observance of COVID-19 precautions. Yan. Yun. So as we move on to what we call the new normal, let me end my presentation by saying that the fight against COVID-19 is far from over. The pandemic hasn't ended yet. Until there's an effective vaccine or treatment, everyone remains at risk of COVID-19. We need to work hand in hand to defeat this unseen enemy. And as health professionals, we are responsible for educating not only the individual of the correct information, but also the family and the community. And this information and family focus and community-oriented interventions will help us achieve a COVID-19 free community. To our frontline workers who are still there fighting the COVID-19 battle, we continue to salute them for their sacrifices and their nobility, and endlessly pray for their safety. And we also pray that this pandemic will soon come to its end. So that would be all. Thank you.